Hello everyone, I am Dr. Nitin Agarwal and today we are talking about epilepsy. Epilepsy or seizure disorder, or in common layman's word what is called as fits, is very common disorder, but it goes most of the times unnoticed. So epilepsy is abnormal movements of the body part. Usually it is generalized epilepsy where entire body gets abnormal movements. Sometimes it can be a partial, only one hand or one leg, or even facial features can cause abnormal movements, that is partial epilepsy. And rarely we also see absence seizures, that is, there is no obvious abnormal movements, only some eye movement, staring at some place, not responding for few minutes, so or few seconds also. So that is absent seizure. So these are three types of epilepsies commonly we see. It can happen by due to genetic disorder, by birth also it is commonly seen, or it can happen as a secondary disorder due to some head injury or a stroke or any infection in the brain which can cause some electrical disturbance in the brain. So how we find epilepsy? Usually by doing brain scans, and we also do electroencephalogram, that is EEG what we call. So these are simple tests done in the hospital on OPD basis to detect epilepsy, and epilepsy needs to be treated. If epilepsy is not treated, the brain damage is significant, that can cause memory loss, that can cause dullness, that can cause some weakness. So epilepsy needs to be treated. There are many myths about epilepsy or fits. When a person gets epilepsy and in a public place, so best way is to just clear the space for some air, make him lie down on a side position so that his breathing pipe doesn't get choked, and within some minutes it will subside usually. If it doesn't subside, then we call it is some serious problem, that is status epilepticus. But most of the seizures, they subside within few minutes, and once he is settled, he can be taken to a doctor. But there should not be any panic. Some people do very different local methodologies, they all don't help. Just make sure they don't have any injuries, and they should take regular medicines for epilepsy. What we suggest for an epilepsy patient is not to drive either two-wheeler or four-wheeler, because epilepsy itself won't kill, but usually if a person who is having epilepsy, especially in initial 3 to 6 months till the medicines are set, or the dosages are set right, till then they should avoid driving or riding. They should avoid swimming, because that again can be detrimental. If while swimming seizures come, they can have drowning, they can die of drowning. And thirdly, they should also avoid heighted places, or working with some equipments which are hazardous or which are very sharp, that can cause injuries when they have epilepsy. So if they avoid these things, it will always be very simple. With medication they do well, and it is very well treated and can be treated very easily. Most of the patients, we stop medicine after 2 to 3 years. Only if it is congenital and genetic, till their adulthood, definitely we continue the medicine, and some people need lifelong medications. Thank you so much.